Next, we have Miss Carrie Thorson for Aquatic Physical Therapy for GM1.
My name's Carrie Thorson, and I'm here from Aquatic Rehab and Consulting. We provide aquatic physical therapy in the pool. And just a shout out to Rojan in the back for letting us know this was going on today and for letting us take videos and photos of Darian, who has been a great participant for us for several years. Okay, what do we utilize aquatic physical therapy for? So just basically it allows for independent movement sooner than land-based therapy because obviously we don't have that gravity factor that kids have to worry about. It's an alternative to traditional land-based therapy techniques, provides a safe environment for family and individual interaction, a lot like Jillian was talking about, getting the brothers and sisters and family involved, and promotes confidence and a sense of community when they can participate a next door neighbor's birthday party, backyard pool party, or whatever. Okay, go ahead, next one. Okay, what is aquatic therapy indicated for? So these are general terms right here, general classifications, disorders of bones, joints, and muscles. This particular picture would not be somebody I would put in the pool right there. I would send you back home. I'd send you to the ER, and you're not getting in my pool. But neurological, developmental disorders, cognitive, and behavioral delay. Okay, first classification, disorders of bones, joints, and muscles. This is just an example here. There's so many different diagnoses, but in general, these may be the ones that you're more familiar with. Juvenile arthritis, muscular dystrophy, spina bifida, orthopedic abnormalities, osteogenesis imperfecta, another one. But again, this is just a very limited list, and there are so many different diagnoses that we do see in the pool. That next category was neurological and developmental disorders. Again, general classifications, head injuries, cerebral palsy, seizure disorders, genetic disorders. Okay, go ahead. Cognitive and developmental delays as well. So mild to moderate delays, perceptual disabilities, and autism. Mild to moderate delays only because severe delays, we have a hard time keeping those kids safe in the pool. Physiologically, I'm 4'11", so if you bring me a very severely impaired 6'1" person, I'm not really sure that I can keep that person safe in the water. And there has to be, foremost, a level of safety that we can offer while we're doing this physical therapy in the pool. There's Darian and his buddy Michelle, super cute. Goals for aquatic intervention. PT operates off of goals in the pool. That provides us the opportunity to make a care plan. How are we going to reach those goals? So we'll take a look at orthopedic, neuropsych, social, and developmental goals, and we'll break those down a little bit. Okay. Orthopedic goals. And this is true across the board, right? Strengthen posture, manage weight bearing, strengthen muscles, progress balance, improve coordination and endurance, improve gait, improve range of motion, goes on and on and on. These are just the big basic categories. So let's look at this next slide, and I think we'll have a better look. This is going to be Darian, and you can play that video if it goes there. And if there's, don't worry, if there's no volume, I can tell you what she's saying. So you can just keep playing it right there. So let's take a look at what's going on with Darian right here. If you can get it to play, if it'll go. There you go. And you can just stop the video right there for a sec. So what we can see here is Michelle, that's the PT behind Darian there, has her hands on his upper thorax right there. She's providing some level of trunk control, while this lower body is supported through the water through a property we refer to as hydrostatic pressure. So that's that billions of points. If you remember science, it was Pascal's law where there's a billion different points of pressure along the body that's providing support to the lower extremities as well as to the pelvis and the lower abdominals. He does have his AFOs on in the water to provide a little bit more grounding and a foot flat position for him. But with Rojan outside of the pool and Michelle providing some stim, he is able, we can play it one more time. He will pick his head up. He'll take a look. Hold on. Yellow. Hello. He's all proud of himself right there. Okay, good. All right, let's skip to the next one right there. Slide. Yeah. Okay, so this is a still photograph here, but just to review what we're trying to do with our neuro kids: sensory integration, normalize muscle tone. We do that by the heat of the water, decrease tactile sensitivity. You know, when the water's surrounding you in a billion different points, it tends to dampen those overstimulated system and just decrease any tactile sensitivity that the child may be having, carries over well to land. And of course, improve proprioception. If that's a word you're unfamiliar with, we know where our arm is without looking at it, right? And that's stretch receptors, Golgi tendon organs, all those things in the joint that relay those messages to the brain and let us know where our limb is. Okay, next slide. Okay, so we got two videos here. We can play the one on the left. Again, just reviewing the neuro goals that are over there with the sensory integration. Just watch this slide for a minute, and then I'll tell you what's going on here. Okay, and so let's just play that same video. And what's happening when Michelle sways him side to side is we're getting a stretch receptor response on the lengthened side of the body. We're getting a contractual response on the opposite side of the body as those Golgi tendon organs stress and want to pull the joints back into alignment. So we're just trying to coordinate the motor movement to the motor pattern so that the child can start to make a relationship between what I'm feeling in my body and how can I help do this on my own? Can I participate? So by moving laterally, we get that movement that's needed for reciprocal motion that happens in gait training. When we play the video, we can play the next one. She's going to be moving him anterior, posteriorly in the water, and we don't need any audio on this. So as she moves him forward and back, we're getting that anterior, posterior pelvic sway, and we're learning how to facilitate abdominals and trunk extensors, again, which we need for standing balance, sitting balance, and then hopefully progressing into a gait pattern if we can get to that. Okay. Next slide. That's fine. Yeah. Psychologically, okay, so reduce anxiety as confidence improves, behavior modification, improve self-image. We see all of these happening as the child progresses in the water. It's pretty normal when we have a child start for the first time that they're freaking out because it's stranger danger and there's a lot going on. There's a lot of people in the pool, there's a lot of turbulence, there's a lot of noise, there's reflection on the water, so it can be an overstim environment. There are always ways that we can decrease some of that stim to help the child to kind of get used to the environment. Never had a child last in this phase right here for longer than like 3 months, so it works out pretty good. Okay, next slide. Some of them are tough. Okay, so let's see what's going on as we. Oh, look at Darian again. Look at his. He's like super excited. Now he's going to start moving his legs around a little bit. He knows that he can move them in this position. He knows he's supported by the buoyancy, and he can make some active movement happen in the legs. We also get upper and lower body and a little bit of abdominals as he kind of curls up and he tries to extend. And Michelle is going to utilize the water and sway him in areas where we can facilitate what we know his strengths are. You don't want a child to be consistently failing at something in the pool. Why are they ever going to want to come back? So we're going to facilitate the active movement that we know that he has, because that's going to provide the confidence and the desire to continue. Makes him happy. Thanks, Rajan. That's a great video. Rajan took that video. You're welcome. Okay, social. Obviously, development of relationships. We have a lot of eye-to-eye contact going on. We don't wear a lot of clothes in the pool. So there's a lot of tactile stim that goes on, right? We can get our fingers where we know they need to be. Community integration, you can get into some group rather than just traditional physical therapy where it's one-on-one. We decrease the disability stigma. We're having fun too. We can do that. And shared family fun. Now mom knows how to interact with their child. So you're at a party, you're in a community event, and you can participate. So that's what we're trying to bring. Okay. All right, let's just play this. No audio is okay. She's bouncing Darian on her knee. She's giving him some proprioceptive input right there. We're trying to stimulate some head control, some trunk control. There we go. And actually, I think Michelle's just enjoying this. But he does too. So now we got that upper extremity active movement going on. But it's an environment, that second bullet point there is an environment of continuous learning. We don't want a child to stagnate, right? If they're having a good time, they're willing to explore and they're confident, they're going to reach out and figure out how to make this environment work for them for strengthening to carry over more in those functional activities when they're on land. All right. And it's safe. That's always good. Okay, real quick, to understand how water works, why do we put these kids in the water? There are actually 7 properties of water. I'm going to bring out the 4 that we use the most, and those are buoyancy, hydrostatic pressure, viscosity, and flow and drag. Okay, so buoyancy. Everybody knows about buoyancy, right? It's that tendency for our extremities or our support and our where we can float actually in the water. So this is a tough video because Michelle is trying to get him to take these steps. And part of it is, he's buoyant. That limb wants to float a little bit. So you can tell that she's going back and forth, back and forth. But if she can get it initiated and get it to move through the water, then the water helps to propel it forward so he can learn that motor pattern and it becomes more habitual. It's a lot of repetition, but without the support of the water, if you were trying to do all that on land, the poor therapist would be done in 2 seconds. And that's the other thing, because he's not going to fatigue as quickly as he would on land. So it allows for multiple repetitions of a single activity. The water becomes our supportive surface. We don't have to lay kids on a mat where they get stuck by gravity. We can lay them down in the water and they still have access to movement, both passive and active movement. And children are always able to explore the movement when gravity is reduced or eliminated. Okay, the next one. The quicker we start that, by the way, the better I believe the carryover is. If a child learns early on that they are able to move and they aren't suppressed by gravity all the time, the quicker those motor patterns start to develop. So this little fella, he's got some CP, and we're trying to get him to stand up, to push. But he's never done that on land. So he's like, oh, I don't know. And we're yelling at him, just stand up, right? He's like, geez, okay, lady. So this is maybe not something he would do in a land-based environment, but right now it's fun. And he's not so sure he's going to give it another. Nope, he wants to scoot off. He doesn't want to have anything to do with it. So again, we're going to work at it. I think we might have bribed him with his favorite toy that's off the screen. But yeah, so now we're just going to let him rest. He got 1 out of there. But yeah, that was Grayson. He must be 8 or 9 by now. But we always use this video because it's just him not really sure, but getting that confidence and going ahead and using that motor planning that he might not have before. Okay, buoyancy does come with its problems. So this little guy, this is Andrea, and she's actually holding his legs down so that she can pattern that walking motion. We had to put a collar on him. We don't use them a lot, but he had very poor head control, and at this stage of the game, we didn't have enough hands. So the collar is right there just so he can have a visual of Andrea, and Andrea is able to keep his feet down on the ground and pattern that reciprocal motion of walking. Okay, we talked a little bit about hydrostatic pressure already. I don't think we really need to go through the science of Pascal. You can do that when you're terribly bored and don't have anything else to do. Let's go ahead and look through the next one there. That's Darian doing sit to stand. And let's talk about viscosity, the drag through the water. And what I'm doing with this little guy here, the limb that I have in my hand while I'm rotating through the hip to get some basic range of motion, it's actually the trailing limb in the water that I'm trying to use that drag to give him a stretch through his hip and through his trunk. Because if I don't stretch him out and I'm going to move on to gait training, he is so locked, has so much spasticity in his lower extremities that they are crossed. And there's no way I'm going to get a reciprocal pattern if his legs are crossed. So these are just different ways we can use the water to help stretch prior to moving on to a functional movement. Okay. Keep going. We can skip drag and flow. Let's take a look at these last 2 slides. And they're going to talk about, yeah, you can move through that one too. No drag. We don't need no drag. Nobody wants to be a drag. Okay, so these last two slides talk about precautions and contraindications, two very different things. Precautions and contraindications, what problem you put on these lists depends on your therapist's comfort level, mom and dad's comfort level, child's comfort level. So things like obviously a history of aspiration, that's a precaution because we know their swallow might be affected and we don't want this child to aspirate. Certain things like, of course, you keep your kid at home. If they have a temp, we have to watch the bowel incontinence, bladder incontinence. But, that's to be expected up to age 3. Severe respiratory compromise because hydrostatic pressure puts so much pressure on that rib cage. The work of breathing goes up 60%. That's a big number. And if the vital capacity is less than 1 liter, that child is going to struggle in the water, and we have to keep the upper trunk out. G-tubes are fine, as long as they're well healed. Most of our kids do have G-tubes. And let's look at that very last slide. And these are contraindications. Uncontrolled seizures. Uncontrolled seizures. Yeah, see, that's kind of a funky word. That means something different to each person. A lot of kids are on seizure meds, and that's okay. We do have seizures from time to time in the pool, as long as they're ones that a parent is familiar with, they're anticipating, they can see it coming, they can give us those cues, and we can take the appropriate measures and wait it out, or take the child out of the pool and give them back to the parent. That's fine. Persistent diarrhea, nope, not happening. Ineffective bowel program, open wounds, no. Menstruation without internal protection. Trachs. What the American Physical Therapy Association's guidelines are on trachs is that children with trachs need to be treated in a medical environment where the pool is associated with the hospital and the respiratory therapist is present throughout the treatment. There's nobody else in the water. I probably wouldn't put a trach in my pool because I can't control the turbulence and I can't control the amount of people that are in there. So 1-on-1 sessions, there's usually 2 therapists per patient, along with the respiratory therapist controlling the vent outside of the pool, and there's nobody else in the pool. So that is the current recommendation when it comes to trachs in the pool. Okay, sorry, that was really fast. Thank you so much for your help. I appreciate it. And any questions, you can see me later. Thank you.